So I'm Dr. Amy Watson of Breakthrough Pediatrics, and I am here with Elizabeth Barth, who is a registered dietitian. So Elizabeth, tell me a little bit more about you and your business.
Yeah, so thanks for the introduction. I am a registered dietitian. So with my business, it's all about nutrition counseling. I do a lot of my work with families with kids, as well as pregnant people who want to get pregnant, or people who just had a baby. But I do see a wide variety of clients as well. It doesn't just have to fit into that.
Sounds good. And what's the name of your business so people can look you up?
Yes, that's a good question. It's TeKer Nutrition. It's kind of a play on words, like supposed to sound like take care. TeKer.
Awesome. All right. So we have some pretty cool topics to talk about today. Most of them are kind of pediatric based. And I think the three biggest ones that we talked about discussing were picky eating, introducing solid foods, and then whether or not kids need vitamins. So we can start with picky eating. Tell me your thoughts about that.
Yeah, so actually, even with the first few words, picky eating, I would actually like to call it more selective eating. It's more than just being picky, right? Sometimes this pickiness or selectiveness that comes with eating isn't just because a child doesn't like it or doesn't want a certain food, but sometimes it comes with a whole array of different reasons, from textures, sensory aversions, smells, just kind of like how your brain is processing everything. It can be very intense for children, but it does vary from each child. And it is extremely common to happen, I would say, maybe around like 4, 5, 6 years old is when it tends to start. A lot of parents will say that their baby ate everything, and then when they got a little bit older, it was very difficult to get their child to eat. So I would say it is very common, but something very manageable and something that can be worked on and overcome.
Good.
Yes.
Very good for parents to hear that.
Yeah. I guess also, I don't know, to elaborate on it a little bit more, like the basics of how to deal with picky eating would be, or selective eating. I think a big maybe mistake that a lot of parents make is that they don't like to see their child not eat, which makes sense. We want to see our child eat because eating helps children grow and get the nutrients that they need. So parents do feel a lot of worry, concern, or even fear of their child isn't eating, especially maybe if they've been told they've always had maybe a smaller child, or just depending on the certain weight, sometimes parents do get pretty nervous about it. So I would say to parents with selective eaters, I wouldn't make it though, just make your child eat anything they want to eat. What I would do is just give your child one option for each meal. Parents pick the meal, they pick the time, they pick where the child eats, and it's up to the child how much they eat, if anything. And I think just being comfortable with your child, if they decide not to eat at that meal, it really is okay. They'll likely they'll be hungry for that next meal and are going to be more open to trying and eating what you give them.
Yep, that sounds very familiar. That's generally what I tell parents, is that you make the big decisions, what food you're offering, when and where and what time, and the child can decide how much they want to eat and what options of that meal, like what pieces of the meal that they're going to actually eat. And then that way they feel like they have power as well.
Yep, exactly. I would even say for maybe a little bit of an older child, or just depending on how dexterous or they are good with their hands, I would even allow them to serve themselves. So your child's going to be the best reader of how much they know and want to eat, and that can help them also try new foods.
That's a great idea. Cool. And then, so I've got a fair number of patients in my practice where the parents say they won't touch any green vegetables, or like it's really hard to get them to eat any vegetables. Do you have any like tips or tricks for those parents?
Yes. So yes, I don't know where this aversion comes from with green. But as you get older, it seems like everyone loves the color green, but definitely with children, I can feel a little scared from it. And that's okay. You kind of want to do it a little, it's a little counterintuitive, but don't worry too much. Again, if they don't want to eat the green thing, kind of step back. Nope, there's no pressure, there's no importance if they eat this green vegetable. It's just there. It's an option if they want to try it or not. I think that's the big first step, is no pressure to eat it or not. Definitely exposure, not just through eating, but through touching and through sight. So now it's spring, it's going to be summer. Definitely take advantage of like fun farms. Farmers markets are just farms with like animals and like vegetables, and have your child see where the vegetables come from through the earth. Have your child pick out vegetables. Have your child, if you can, find a place where your child can like pluck vegetables from an actual ground. That kind of, again, that sensory and touching kind of the sensations can really help with making a child feel more comfortable actually eating that vegetable. And also if you don't really have the option to do that, you can always have your child pick out a certain green vegetable to try, have your child help with cooking and preparing that vegetable. If you feel like you've done everything and anything and nothing really is working, I think it really is okay at the end of the day to blend it in a smoothie and put it in a nice, colorful, fun cup with a top and a straw, and have your child enjoy it.
Yeah. Those are lots of really helpful tips for parents. And I think some of them are things that people wouldn't think of doing. So those are really good pieces of information to share with people. I think I read somewhere that, and this might be for younger children who are being first introduced to foods, that it can take like 10 to 15 exposures for them to even like touch a food, never mind put it in their mouth, never mind eat it.
Yes, it can take up to I've even read 15 to 20 tries. So it can be a wide range. So I think also a lot of the times parents will feel discouraged. First or second try, a child doesn't want to eat that new food, and they just kind of give up giving it. But I would say don't give up. Just because a child doesn't eat it doesn't mean that's a failure. I think if your child's able to tolerate it being on their plate, if they touch it, if they play with it a little bit, you can even encourage your child to kiss the vegetable. Again, this is all just about that exposure that can help the child eventually eat that new food or vegetable.
Awesome. And then for kids who have kind of more sensory-based issues with foods, is it better to like present the foods in a different way, like a different form, if they're having like more of a sensory aversion?
Yes. So it's a little bit out of my scope when it comes to dealing with, especially with like a heavier or more severe sensory aversion, but I've worked a lot with feeding therapists or speech language pathologists before, and I've learned a bit from them. But there are great techniques to deal with children with sensory aversion. So for example, if your child really only likes, let's say, I've had another example, they only like goldfish for snacks. I've had a parent that I would recommend to put the whole grain, different types of goldfish mixed in a bowl with the regular goldfish. And over time, they really would just eat anything in that bowl, whether it was the regular goldfish or whole grain goldfish. So doing like a mixture of something that they're familiar with something a little bit different can be really helpful. Or putting things in like a different shape, or kind of an altered version. If your child really likes mashed potatoes, can you try mixing those mashed potatoes with like a mashed other kind of vegetable?
Cool. That's helpful. And so I think the take homes with selective eating, we won't call it picky because it really
we can call it picky eating.
Yeah.
Yeah.
I think also when kids hear that they're picky eaters, they kind of like internalize that sometimes too.
Yeah, it can make them feel bad about it. So that's why I kind of like the word selective eating. And again, it's not this we kind of have to think it from their point of view and from their development. And I think that can be helpful to parents too.
Mhm.
Their taste buds are extremely more sensitive all over their mouth. Their senses of what they're picking up can be, for example, I don't know, I couldn't really measure it, but it could be like 10 times stronger than what we would sense it to be. So just kind of remembering that they have a very different experience with the food. It's really based a lot in the brain. So it's not quite just a child as being, your child's not trying to be frustrating, your child's not trying to be mean or manipulate you. It's just, they're having a hard time with it. So just kind of learning techniques to help them cope and learn this new way of eating.
Mm-hmm. That's all super helpful, super important for parents to know. Yeah, your kid's not doing this on purpose. They're not trying to be a pain. It's not their fault. They're going through a lot.
Right.
And it's really like a parent's job to just try to support them and also be persistent. I think that's like the biggest take home.
Yes, be persistent. Don't give up if your child didn't want to eat it. But I also would want to kind of piggyback off of that. Don't pressure too much for them to eat. For example, the vegetables, right? We all want our kids to eat vegetables, but don't put too much pressure on it in a way that like, you have to eat this, because their child will learn that, wow, my parent is really pressuring me to eat this vegetable. It must not be good. And don't reward your child for eating a vegetable by giving like a dessert or things like that. Don't make it too big of a deal. We can be happy about it that they tried everything, but we don't want to put too much either negative or too much positive reinforcement with trying vegetables. It should just be kind of like a part of their diet and every other food.
Right. Just another part of the day, essentially.
Yes. Yep.
Okay. Cool. Awesome. Any other like major points about selective eating, or do you want to move on to introducing solids?
Well, I would say with selective eating, a lot of that we talked about again is for maybe the more neurotypical child. If you have a child with really severe sensory disorders or aversions, or a child maybe on the spectrum for autism, this would definitely be tailored in a different way. So just kind of wanted to make that clear.
Yeah. And so would it be kind of a more individualized, specific plan with those children?
Yes.
Okay. So those families will probably really benefit from someone like you on their team.
Yes. Yes, definitely.
Okay. Awesome. Cool. So introducing solids. I know there are a few different ways that this can be started. I want to talk about it and tell me what you think about the different like ways that we can introduce solids to babies.
Yeah, so it's usually a very exciting time for parents when their child or baby, right, is ready to begin solids. I think there is a bit of confusion though when exactly to begin solids. So for a while, it really was always just 6 months, but recently in the USDA 2020 guidelines, it's been updated to state that solids can actually be started anywhere between 4 and 6 months. Again, this is really individualized, so not every baby will be ready at 4 months. Some are ready at 5, some are ready at 6 months. It's okay. One baby is not better than the other. One baby won't be more advanced than the other if they start earlier. It's just important not to start before 4 months because your child isn't ready. Your GI tract, like stomach, swallowing, everything from mouth to the bottom of the GI tract really isn't ready for food yet. So just kind of keeping that in mind. So that's kind of a good timeline. Could be 4 or 5 or 6 months. And it'll be important to discuss with your pediatrician, like you, Dr. Watson, right? Exactly when your baby is ready to begin solids. So that maybe you probably recognize some of the cues when an infant is ready, right? So your baby will be staring longingly at your food when you're eating. They have pretty good head control. Maybe you notice they're putting more objects or their hands to their mouths. Things kind of like that tend to be a good sign that your baby is ready to begin solids.
Definitely. Yeah, those are the major things I look for. Head control, interest in food, putting things in the mouth, reaching for things, and then like sitting mostly unassisted. Like, can they mostly sit up in a chair without full assistance? Those are the major
Yes.
ones. Yeah.
Yeah, exactly. And I would even want to point out too, I've seen it just once before, but some people have heard the wrong advice that, oh, your baby's ready to begin solids when they have, I think, a pincer grasp, that's called. But
Yep.
that's not a sign of readiness. And this kind of grasping wouldn't come probably until like 8 or 9 months or maybe later, give or take. So yeah, just like you said, pretty good, able to sit upright nicely without much assistance, interest in food, and then the grabbing for things and putting hands in objects in mouth.
Yeah.
And then I'm sure a lot of people are also wondering, well, what do I give my baby to? I would mostly say you can give your baby really anything. There's no one food you have to start with. Again, you might have heard before, like you give your baby rice cereal, but now the new evidence is showing that you want to give your baby really just a wide variety of foods. You can start with a fruit, you can start with a vegetable, you can even start with meat, beans, really anything. I would, though, just prioritize the foods high in iron and zinc, just because that's when their stores begin to deplete around that age, usually around like 6 months. So it's a variety of like vegetables and meats and whole grains will be good for the baby. So that's kind of the gist of solid. You can really give any food. It's just with the common allergy causing foods, you would just give one at a time, kind of wait a couple days in between. As long as they tolerate it, no signs of allergies, you would just continue to give that food to them.
Yeah. Awesome. Yeah, there have been studies, especially with peanuts, that the earlier the foods are introduced, the less likely kids are to actually develop an allergy. So I definitely recommend introducing the allergens on the earlier side, and definitely one at a time, just like you said, so that if there is an issue with a certain food, you're going to know which one it is. If you introduce 5 different foods at a time and they get sick or have an allergic reaction, it's going to be really difficult to pinpoint which one caused the problem. So definitely slow and steady.
Yes, slow and steady, but not to avoid it.
Right, definitely. And then, so we've got like, I think 2 major camps when it comes to introducing solids. There's purees and then there's baby-led weaning. So talk to me about those.
So people feel really passionate, I think, about the types of textures that they give their babies. I would say, unfortunately, just like with many things in science or nutrition, there's not a clear-cut answer with that. Again, it's going to be really individualized for your baby. Just looking at the guidelines and the evidence from 2020 was that there's no actual texture that would be recommended exactly. Me personally, I'm working with babies that are just beginning solids. I think it's just a little bit safer and better to start with a puree. If your child is doing amazing with purees and they're just really able to chew it and swallow it and they're great at it, you can certainly advance the texture to pieces that are maybe a chunkier puree or really minced up kinds of foods, or maybe you just want to mash an avocado or mash a banana, and then you can continue to advance it as you see fit, whether that be more like finger kinds of foods. But I do though see it, though, at least just from my own experience, when people try to just do baby-led weaning right away, it's actually kind of hard for the child to actually intake that food, and then they may not be actually getting the nutrients that they need. So I think maybe if you could do a mixture, right, like have your child eat purees or thickened purees or mushed up kinds of foods at first, you can certainly have your child kind of begin to play with bigger pieces of food, like whole foods, as long as you're watching them. And we definitely want to avoid choking hazards, because that's kind of another issue with baby-led weaning. So that's kind of my take on it. I'm not necessarily for it, I'm not necessarily against it. Just be kind of dependent on your baby.
Yep. Definitely seems like something that should be more individualized. And I think I agree that starting with more mashed up or pureed foods is probably your best bet for safety and for like the baby's comfort and ability, like physical ability to ingest the food. I think purees are a much easier way for them to be able to get the food in their mouth, use their tongue in their mouth effectively and swallow it. Whereas baby-led weaning can be a little bit more difficult, maybe even more frustrating for the baby.
They can't really, it's just such a big jump, right? From, I know to us, it seems so basic to chew our food, but there really is this window of time in their life for just that, again, that sensation of something other than breast milk or formula going in their mouth takes a lot of like, the wheels are turning in their brain to figure out how to like ingest that actual food.
Yes, definitely. And I think a lot of, especially first-time parents, even with purees, some of the first few exposures their baby has to solid food don't go very well. Like there's a lot of gagging, a lot of spitting, the food is everywhere. And so I try to reinforce to them that that's okay. That's a totally normal reaction and that, you know, just keep trying, take it nice and slow. Like it will get better.
Yeah, that's really normal too. Like if your baby's kind of gagging on it or like just like not into it. Yeah, like I would even say like you could take a break, you know, you don't have to force them and just kind of come back to it in a day or so. And when they do begin to eat, it is okay if it gets messy. I know that's difficult. I mean, that I get it. Like it would drive me crazy to seeing the mess everywhere. But like you really do have to just be okay with the mess and have them get a little messy. That is the best way for them to eat.
Yeah. It kind of comes with the territory. They're exploring everything with their hands, exploring everything with their mouth, and the mess just kind of comes along with it.
Yep. Exactly.
All right. That was good. That was super helpful. I'm trying to think if I have any other points about introducing solids that I think would be helpful. Is there anything on the top of your mind that we haven't talked about yet?
Well, I think it's good for parents to know when they do begin solids that your child or your baby will still really rely most of their nutrition from breast milk or formula or formula, whatever you're using to feed your child. Really just the beginning of trying foods is just about them testing a variety of flavors and textures. So really at first it's just going to be maybe like 1 to 2 teaspoons, maybe once or twice a day. And then eventually it kind of builds up maybe to like a few tablespoons of each food, maybe twice a day. So it won't be a lot. It's not like you're going to think, oh, wow, I can now breastfeed so much less or give less formula. It's probably not going to change that much. That kind of takes a few months to kind of get in more food in their bodies.
Yep. That's a really important point that I did not even think of. So thank you.
Yes.
It takes a long time for them to really start eating, like actually having food be most of their diet.
Yes.
It's definitely breast milk and formula. And it does take several months to kind of ramp up how much they can eat and how like the amount of formula in breast milk will slowly go down, but it does take quite a while.
Yeah. And then they'll still need it until at least they're 1 anyways with breast milk and or formula.
What are your thoughts? So we didn't talk about this yet, but what are your thoughts about at 12 months when, you know, some of these kids will continue breastfeeding, but for the kids who are formula fed or, you know, when parents are done, if they're done breastfeeding at 12 months, what are your thoughts on cow's milk? Is it necessary?
It's definitely, I don't think it's necessary per se, but it is a really nice source of calcium and protein, and especially for a child that's 1, they should be getting a full fat source of some kind of liquid, and cow's milk is going to do a good job of that. So it's really helpful, but it's not extremely absolutely necessary either. You could probably really do any kind of milk around 1. I just don't love maybe the milk alternatives like oat milk or almond milk because they have really little fat and really little protein. So for an adult, like of course that's fine, whatever you'd like to use, but for a growing child, I would like to see a nice like rich fatty protein source for the child that drinks of cow's milk is like a nice, easy one. But there are alternatives, of course, a 1-year-old use as well.
Cool. That's really helpful. Yeah, I think a lot of parents will worry like, oh no, they shouldn't be getting something full fat, but the fats are so crucial for their brain development. And I think that's something that doesn't get taught enough. So that's a really important point to make. The fats and the proteins are super important.
Yeah, fat has never been a bad thing. Unfortunately, It has been demonized, but especially, like up until even 3 or even a little bit older, fat extremely important in the toddler's diet.
Yeah. One thing that I see in toddlers with milk is that they love their milk and they drink way too much and they get constipated. And that is a struggle for those families.
Yes, that can be a struggle. I guess I would say, look at when you're giving milk, what are they eating? I would say it depends how much milk you're giving them, but I probably wouldn't go more than either like 2 to 3 cups per day. So that's 2 to 3 8-ounce servings of milk for them. Can you try to feed first before giving milk? Can you make sure they're also drinking water? Because that will be really important. Maybe you want to switch up the dairy sources like cheese or some yogurt if you do give dairy to your child. But yeah, just I think feeding first too before giving milk can be helpful. I
think that's a great call there. Yeah. If they drink their milk first and they get full, they're not going to want to eat their meal. And it kind of is a self-perpetuating thing where they just want milk, they get constipated, and it's messy. So I think eating first and encouraging more water intake those are great ways to get around that.
Yeah.
Cool. What else? Vitamins. I know in my experience, a lot of parents, they feel like, oh, my kid, I don't know if they're eating all the right things that they should be eating. Should they be on a multivitamin? And there's a lot of like fear and concern around it. And I try to tell them that if their child eats like a pretty normal, unrestricted diet, that they should be getting all the things they need from their diet. But are there instances where you definitely think that vitamins are something that kids would benefit from?
I do agree with you there that if your child eats a pretty well-balanced diet, that they probably won't need a multivitamin. I also, maybe you can correct me on this, I don't know if it hurts to give a multivitamin either. But there are a few things, just depending, I think I had mentioned once before, or maybe I haven't. I would like to see someone on a vitamin D kind of supplementation, especially just because if you live in New Hampshire or anywhere in the northern part of the world, or really, really southern part of the world, right? If we're just not near the equator, we don't have a lot of sunshine, or the sun rays aren't very strong, and that's one big way we can make vitamin D in our body is just standing out in a nice, strong summer sunny day, which we do not have a lot of. So it's kind of hard to get all your vitamin D nutrients from food. So I feel like it's pretty okay to definitely be on vitamin D supplementation. And again, it does just depend on a child. Do they have an iron deficiency? If so, what are we doing for food to help with that iron deficiency? If you do want to do iron supplementation, you would just have to keep it at a lower kind of dose, just especially for a child under 6, because it would be dangerous for a child to get too much iron. So there are kind of like kid-friendly like iron supplements for children under 6, but that is not for everyone. That would again be very like specific to a child that had an iron deficiency, and then with food it was not improving.
I completely agree. Yeah. The state of New Hampshire requires that kids are tested, their hemoglobin's tested to make sure they're not anemic at age 1 and 2. And so that's like an opportunity if they are anemic to check their iron, their ferritin levels in their blood and see if it is, in most cases it will be an iron deficiency anemia, and it's usually dietary. So my first
could be too much milk.
Yes.
Just not eating enough.
Absolutely. Too much milk, not eating enough, not getting enough iron. So usually I'll try to make interventions where I'm encouraging the parents to introduce more iron-rich foods to the diet. And then I'll recheck after maybe 3 months or so. And then if we're still not having any luck getting that hemoglobin back up to a normal level, then I would think about like an iron supplement. And it's definitely kind of a weight-based thing where it's tailored to that specific child so they don't get too much iron, because too much would be toxic and then would run into more problems down the road.
Yes, right.
And sometimes, so multivitamins, generally, I think they're benign. And I think for a lot of the multivitamins, the majority of things in them are water soluble. So even if they're getting a little bit too much, it's going to come out in their urine. The ones that I get a little bit worried about are gummy multivitamins that taste really good and they have iron in them, or other fat soluble vitamins like A, D, E, and K. Because those are the ones where if they get too much, you can have like an overdose phenomenon and they can get really sick. So I try to caution parents, if you've got delicious gummy vitamins that have these ingredients in them, you have to be very careful that your child only takes what's recommended.
Right, exactly.
Yeah.
Are you worried about the gummy vitamins too, about like with the sugar on their teeth? I've heard about that with some parents are worried about that.
A little bit. I think honestly, if they're getting one gummy a day, it's really not a big issue. I would worry about them wanting to eat more and getting the whole bottle. But I think in general, like something sweet like that in moderation is not like, if the kid is really going to benefit from the multivitamin and that's the only way you can get them to take it, then I think you kind of pick your battles. I think, I don't know, I feel like the last like 5 to 10 years, culture has been changing and there's been a lot of like shaming for giving kids processed sugars and refined sugars, and there are a lot of fads, and I know that a ton of refined sugar is not great for a kid, but in small doses and using things in moderation, I think it's all okay. But if your child has terrible teeth and they're eating tons and tons of sweets, probably not a good idea to introduce more sweets to their diet.
Right. And that gummy, I think, has maybe 1 gram of sugar. I don't know. It's very little.
Yeah, true. It's not like, it's nothing that's going to really like hurt them. It's not going to make them diabetic.
Right. Of course.
Definitely. Awesome. Any other thoughts?
That's all that's all I really have on vitamins. I'm not like a huge vitamin person. I'm not really recommending them to my patients because I'm a dietitian. So of course I want you to go through everything to see what can we do lifestyle and diet wise. I think really the big one is probably vitamin D. You probably will need some kind of like gummy or vitamin or supplement for that. So it's usually best to go through your pediatrician for that.
Yeah, that sounds good. I agree. Like if we can be getting all of these nutrients and things from our diet, we should be doing that first. Instead of relying on like what can we take instead. It's food should be medicine as well, and that's really important. And I totally agree that in the northern hemisphere we're probably all borderline vitamin D deficient, if not like frankly vitamin D deficient. So having some kind of vitamin D supplement is probably a very good thing, especially for bone growth and all that kind of stuff.
Yes.
Awesome. Did we have any other topics? I have them all here. I think those were like the major ones.
Those were the 3 big ones.
Yeah. Okay.